Hello, my name is Sharifah Dania. I'm from BCT program and I will be presenting about cutaneous lupus erythematosus, short for CLE. CLE is a broad category of autoimmune connective tissue diseases that affect only the skin. CLE can be classified into three major subtypes: acute, subacute, and chronic cutaneous lupus erythematosus. Moving on to the anatomical structure, first we have epidermis that act as a biological and physical barrier against the external environment. Epidermis contains 4 major thin skin layers and 5 major thick skin layers. From the thinnest to thickest are stratum corneum, lucidum, granulosum, spinosum, and germinativum. For the dermis, it maintains and protects the skin's deeper layer and contains 2 layers which are papillary region and reticular region. And then hypodermis, this layer contains lamellated corpuscles which detect external pressure applied to the skin. The symptoms for acute CLE is a butterfly rash, which is the redness that occurs over both cheeks and extends over the nasal bridge. For chronic CLE, you will see a red to purple rash, scarring of the head with hair loss and in the ear. These lesions will gradually develop into a cone-shaped plaque that is painful to remove. Subacute CLE, the symptoms are red and scaly, non-scarring rash and highly photosensitive, and occur in sun-exposed areas at the surface of arms, forearms, and upper back and upper thorax. CLE can be diagnosed by doing a skin biopsy, which is a procedure to remove cells or skin samples from your body for lab examinations. Direct immunofluorescence involves the applications of antibody fluorophore conjugate molecules to sample patient's tissue. Next, blood tests involving full blood count, renal function tests, inflammatory markers. Serology, including ANA, ENA. Serology is a study of serum and other body fluids. ANA test evaluates presence of autoantibodies, and ENA test determine which protein in cell nucleus the autoantibody recognize. Unfortunately, there is no cure for CLE, but can be controlled by a variety of medications and lifestyle, since lupus can be triggered by any sun exposure. We can prevent it by using SPF 50+ sunscreen and a UPF 50+ protective clothing. We can also consume vitamin D to contribute to skin cell growth, repair, and metabolisms. For treatments, there are local and systemic therapy. Topical steroids are medicines that are applied directly to the skin to reduce inflammations and irritations. Intralesional steroids is an injection procedure to deliver our medications directly into the skin lesion. Antimalarials, usually we use hydroxychloroquine sulfate. And immune modulators, a substance that stimulates or suppresses the immune system. Systemic corticosteroid, it has profound anti-inflammatory effects. The prevalence of the disease is that over the past 30 years, lupus erythematosus is reported to have been diagnosed in more than 10,000 people in Malaysia. Approximately 90% of patients are women, with the remaining 10% being males and children. That is all from me. Thank you very much.